kneecap is grinding not on the groove that it should be, as opposed to now it's out of the groove and now it's grinding on the side. And over time, that's going to cause inflammation, and that will then cause the swelling. That's why you experience swelling in the knee. If you're wondering why your knee swells up after you warm up on the bike in physical therapy or in the gym, then you've come to the right place. Hello, I'm Dr. Lin with Empowerment Physical Therapy, and today I want to tell to you about why you should warm up in the bike if you have knee pain. And here's the reason why. Most patients go into a traditional physical therapy clinic where they would get a hot pack, TENS unit, and the next thing, or sometimes they're told to warm up at the bike. Especially, warming up at the bike isn't a bad thing. Don't get me wrong. Warming at the bike, if you have knee pain and you're to warm up at the bike, it's gonna do more harm than good. And that's why one of the ladies who I spoke with a couple of weeks ago was telling me exactly the same thing. And here's the reason why. It's because if you have got knee pain, the little bone that's on top of your kneecap probably is not sitting in the groove that it should be. Imagine my index finger as a kneecap, and in between my knuckles is the groove in which your kneecap sits in. So if you don't have knee pain, it's typically sitting in the center of the groove, so that when you straighten and bend your knee, it'll kind of glide, that kneecap will glide in the groove naturally. In the case of your knee pain, most of the time, that kneecap is out of the groove, and it tends to go toward the outside of the body. And so what happens is when that kneecap is out of the groove and you're on the bike and you're asked to straighten, and as you're biking, you kind of straighten and bend your knee, and now that kneecap is grinding not on the groove that it should be, as opposed to now it's out of the groove and now it's grinding on the side. And over time, that's going to cause inflammation, and that will then cause the swelling. That's why you experience swelling in the knee if they ask you to warm up on the bike. You shouldn't. You should not be doing that, because of the fact that the kneecap is not in the groove. Biking makes it worse. So stop doing that. That's the first thing you need to do. Because I had the pleasure of speaking with a lady a couple of weeks ago. Let's call her Claire to protect her identity a little bit, where she had fell on the concrete on both knees in Florida. Thank God she didn't fracture anything, so that's a good sign. And it's about 4 months and her knees haven't healed. It was bruised, it was swollen. She was taken to the urgent care and was given steroids, which are anti-inflammatories, which you typically get when you go to an urgent care center, where they'll kind of x-ray you, give you some medications, and send you on your merry way. My thoughts on the urgent care, that's a whole different conversation about what I think they should be doing, and not just give you pain medication and x-rays. There's a time and place for x-rays, but the pain medications, that doesn't solve the root cause of the problem. Anyhow, so she's been experiencing this for about 4 months. And she's frustrated because she thinks that it should have healed by this time. And why is it not? because it's still swollen, it's still bruised. She elevates it and ice it 1 to 2 times a day. She's able to walk about 1 to 2 miles at this time. She used to be able to walk 4 miles. She's a musician. So after talking to her, then she's been let down by 2 physical therapists. The first one had her on the bike and flared up her knees. And after she had told the therapist to stop, they did it. So she stopped going there. And then her doctor prescribed it full therapy, which helps with swelling. It's great with knee swelling. But it was a young therapist, and she was kind of having an argument with, kind of fighting a little bit with her. So that didn't work out. And then she had to resort to a cortisone shots, which is something that I don't recommend. Here's why. Cortisone shots don't solve the problem. It's an anti-inflammatory shot that'll get rid of the pain instantly. Sometimes, but it doesn't last well. It might be really good for acute injuries. Now, if you've got a function event or a wedding that you need to attend to, and you're in a lot of pain, and you need to get through that, by all means, do what you got to do. But a cortisone shot isn't gonna solve that patella, that kneecap alignment. If it did, and they told you so, they're lying to you. But she ended up, obviously, I'm not going to fight her for getting an injection. So she did end up getting an injection and let it sit in her system for a little bit. And it still hasn't gotten better. It still hasn't better. So if you're kind of going through a similar situation where you've been giving, and this is a typical sort of cadence that we see of patients who come to see us, where they've been giving medications and they're told by the doctors who have good intentions that take this, let it sit and wait. It should help. It'll go away. Time will heal. Time won't heal every wound without the right intervention. So it's time, and doing the right things in the right order is what's going to get you to where you need to be. She's now currently frustrated because this recovery is taking much longer than it should. And like a lot of us, 4 months into that kind of injury, you get frustrated. You get annoyed. Your patience is up to the brim, into the neck, where you kind of snap at things that you normally won't. And that quality of life has decreased because of that. Her mobility and her independence has been compromised. She's now looking to move because her son lives in New Jersey. And she's thinking about moving from Connecticut to New Jersey. But she hasn't fixed up her knee. So that's a big issue. It's frustrated her. Kind of made her depressed because her mobility and independence is compromised. So what should have been done, and that it's not a hard fix, we see this all the time of someone with knee issues. That you need to first loosen things up in your thigh. Look at the hip, look at the ankle to see what's going on. Because if you don't look at what's above and below that's causing that knee issue, then you're missing the whole picture. It's called connected. The kneecap is the first thing I kind of look at. And then we'll look at how the hip is doing in relation to the knee and how the ankle is affecting the knee. Because essentially, the knee is the monkey in the middle that suffers. If there's something wrong with the ankle or the hip, guess what suffers? The knee. That's what happened. So soft tissue stuff is the first thing we need to do, is to loosen you up. What you need to do is to reset your system the same way you would restart a computer. Sometimes I wish it would be as easy as pressing a button to restart our system. but it doesn't because it takes time. And then the second thing is to reload. Once you kind of get rid of pain, then we can add strengthening in there to keep you stronger, to get you strong. Excuse me, is to get you stronger because you can do a whole lot more without pain. Now, once you kind of are gradually getting stronger, then we need to kind of reinforce that new behavior so we can keep you strong. Our philosophy is pretty simple. Get you out of pain, get you strong, and then keep you strong. And the second thing we need to do is to kind of realign the kneecap back to its groove so that it could stay in the groove. Because then when it stays in a groove, you'll hear less of the clicking that sometimes is not painful, but it's annoying. It sounds like something is breaking inside. It doesn't hurt, but it's annoying. And so that's the second thing we need to do is kind of get it aligned. Once we get it aligned, we want to keep it aligned. And that you might need to wear compression sleeves to kind of keep that thing aligned. So that's my spiel. There's my spiel about making sure that you don't warm up on the bike if you have knee pain. Once you get aligned, then you can get on the bike, get things warm up, so you can get ready for the next day. But if the bike swells up your knee, you need to take care of that kneecap in the groove first. Correct that alignment first before you get back on the bike. I'm not opposed to getting on the bike and warming up on the bike. I'm opposed to the bike causing that swelling in your knee. Because if you don't triage that swelling, you can't get the strength back. Swelling is the first thing you need to get rid of in order to get your strength back. Because if you don't get the swelling out of that joint, kind of like it's going to take that much longer for you to gain strength and develop strength. It's like think of swelling as if you're trying to move really fast in water. Think about that. A lot of work to move in water. And that's what your joint and your muscle is doing when you have excessive amount of swelling.